Hello, this is Dr. Frank Patterson from Georgia Chiropractic Neurology Center. I'm one of the staff doctors here at GCNC. Today I'm going to be talking to you about adult attention deficit hyperactivity disorder, or adult ADHD. It's not just for kids. When I initially gave my talk about ADHD, it was more geared towards children. Oftentimes we think of children when we think of ADHD. But I had a lot of requests right off the bat from my patients when I said, hey, I just recorded this talk. They're like, did you talk about adults? And I said, I spent the vast majority of the time talking about children. So I want to touch on some of the differences between adult and childhood ADHD and talk about how we can help adults with ADHD here at Georgia Chiropractic Neurology Center. So topics for this talk. We are going to talk about what is adult ADHD, how is adult ADHD diagnosed, how is adult ADHD typically treated, and then yes, there is treatment options in addition to medication. Many of our patients are medicated, some are trying to get off the medications, all of them are looking for something more. How do we get to some of the root causes of what's going on as far as why I have difficulty paying attention and why I may exhibit some of these hyperactivity issues. So what is adult ADHD? Adults with ADHD may display inattention, hyperactivity, impulsivity, and emotional dysregulation. This is where one of the differences between adult ADHD and childhood ADHD can differ a little bit. Adult ADHD, some of the literature that if you dive into it, it talks a little bit about emotional dysregulation that goes along with adult ADHD, although this is found in children as well. Children with ADHD challenges or living with ADHD, they often exhibit emotional dysregulation issues as well. But we should take a moment to understand that adult ADHD isn't a separate and distinct diagnosis from childhood ADHD. It's just diagnosed a little bit differently, and it certainly presents a little bit differently, especially when you get to the hyperactivity component. You can probably imagine that hyperactivity in an adult is probably going to look different from a child, but we're going to get into that. And then it should be noted that ADHD is one of the most common neurodevelopmental disorders, and it's usually first diagnosed in childhood and often lasts into adulthood, like we just talked about. So ADHD statistics, some of the research that I'm going to dive into, the findings from it. In particular, on this topic, I tried to get some broad research. So we're looking at the World Federation of ADHD International Consensus Statement, as well as an updated European Consensus Statement on diagnosis and treatment of adult ADHD specifically. So I wanted some meta-analyses that gather research from all types of different research articles and try and bring it together to really summarize what's going on. So I got some of these more contemporary articles that give a broader view of ADHD. So let's look at some of these ADHD statistics. The disorder, which starts in childhood or early adolescence, it's more common in boys and girls, okay? It affects 5.9% of youth and 2.8% of adults worldwide. There's a little bit of a debate as far as those numbers, is 5.9% or 2.8% in adults, a really definitive number. There's some people that say it's a little bit more and it's a little bit lower than those numbers, but those are pretty good ways of looking at it. As 2/3 or more of children with ADHD continue to have impairment into adulthood, many require the transition from adulthood to mental health services. So we're talking about 2/3 or more of children with ADHD will carry over their symptoms and their issues with ADHD into adulthood. So that's a pretty significant number. That's a pretty significant number. And then having 3 or more disorders was associated with a 10-fold increase of the chance of having ADHD in a population study in 20 countries. That's a little bit tougher to digest than some of these other statements. What I'm trying to pull in with that statement from these articles is that oftentimes adults with ADHD have other psychological diagnoses. This can make it difficult in accurately diagnosing ADHD, but it also needs to be taken into consideration that this actually increases the likelihood that you're going to be diagnosed with ADHD if you have some other diagnoses in the psychological realm. So you can see where this could get complicated. It also affects treatment as well, and we'll get into that and the importance of knowing what exactly you're dealing with. So how is ADHD typically diagnosed? Oftentimes we're looking to the Diagnostic and Statistical Manual of Mental Disorders. We're on a new and updated version of the DSM-5 currently at this point. So a lot of this information, specifically about how it's typically diagnosed, comes from the Diagnostic and Statistical Manual of Mental Disorders. One of the challenges with this is that there's no single test to diagnose ADHD. It's also a behavioral disorder that has neurological implications. The DSM is in the realm of psychology. It's not neurologists that came up with this diagnosis, even though there is neurology behind why we exhibit these behaviors and tendencies in the psychological realm. So if there's neurological root causes, you could see where it's important to understand the neurology behind what's going on. And unfortunately, that's often missed, both in the diagnosis realm, and it's often missed in the treatment realm as well. But once again, there's no single test to diagnose ADHD, although there's many different resources out there for testing, and we're going to get into those. So diagnosing ADHD in adults and children, honestly, usually includes a checklist for rating ADHD symptoms, which are known as scales, and a diagnostic interview with the individual or with the adult. So it's going to be a lot of talking and a lot of checklists, okay? And talking specifically with a provider that's going to ask a series of questions or go through their own checklist as far as, do you exhibit these behaviors in these different contexts? So the scales, some of these scales include the Adult ADHD Self-Reporting Scale, the Wender Utah Rating Scale, Connors Adult. So I'm not really going to read through this whole list, but you can see there's different resources for these different checklists. So it's important to acknowledge and understand the symptoms that people are dealing with as far as these different behaviors, these challenges with inattention, these challenges with hyperactivity. But we're kind of just scratching the surface here when we diagnose things just based purely on how do you feel. Because if it's like, it sounds like you can't really pay attention. Well, doc, what's wrong with me? You can't pay attention. You could see where that can become kind of a circular loop that is only so helpful. So adult ADHD signs and symptoms. This is, one of the key areas where it's going to differ adults versus children as far as ADHD. So it's important to understand the differences. With inattention, you're going to see forgetfulness. Not to say that you couldn't see this in a child. It just may look different in a child versus an adult. Distractibility with a chaotic presentation in their behaviors and how they organize themselves. Difficulty with organizing and planning. Difficulty listening. Difficulty with punctuality. Either arriving too late or too early. Temporary hyperfocus for highly salient tasks, but no control of attention when required for many essential activities of daily life. So, your day-to-day things, you may get lost in that, is essentially what that's saying, but there may be certain tasks where you're like hyper-focused. In particular, one of those things could be something like video games, right? Like you get really involved with video games, but you can't concentrate and get it together to, make sure that you wash the dishes, walk the dog, put away the laundry, and do things in the proper order. Getting lost in the details, doubtfulness, unable to make decisions or solve problems. So difficulty with decision making. Needing too much time to complete tasks, difficulty starting and finishing tasks, mind wandering, with mental restlessness, unrelated spontaneous thoughts, constantly on the go, jumping and flitting, multiple thoughts at the same time, associative thinking. So that's your inattention right? As far as inattention, hyperactivity, impulsivity, and dysregulation, those are some of the categories. So that's your inattention. Hyperactivity, inner restlessness, difficulty relaxing, pacing up and down, talking too much and too loudly, fidgeting, rocketing, or tapping, not being able to bear an office job because of restlessness, right? You just can't sit at the desk, just like a child can't sit at school. It can be extremely difficult. Knocking things over because of excessive mobility, right? You're constantly fidgeting back and forth and you might knock something over. Being able to sit still, but this comes with muscle strain, right? You really have to force yourself to sit still. Restless sleep definitely can be seen in children and adults. Sleep can be a major challenge, especially when we're looking at, some of the medications. Oftentimes stimulants are involved. We're going to get into that a little bit, but stimulants can interfere with sleep. And it can be a vicious cycle between the ADHD itself can lead to sleep issues, but then, what is purported as the fix for ADHD can lead to more restless sleep as far as the medication with stimulants. So that's your hyperactivity component. Impulsivity, acting without thinking, difficulty waiting turn, linked to feelings of irritability, right? Blurting things out that cause distress to others, right? That could be like a filtering issue. Just essentially saying what first comes to your mind without filtering it out. It may be something that other people in the room are thinking, but they might be aghast because they're like, hey, I never would have said that out loud. Interpreting others' impatience and, interrupting others, impatience and difficulty waiting your turn. Spending too much. And that could be spending too much time in certain areas, not spending enough time in other areas, but spending too much not only could be time, but we're talking about money, obviously. Walking out of jobs, starting relationships too quickly, okay? Not being able to postpone gratification, right? You might look for those quick dopamine hits. Everybody talks about that with social media these days, right? Trying to get that quick dopamine hit. Sensation seeking and risk-taking behaviors. There's a fair bit of talk about gambling with people with ADHD, more prone to gambling. Binge eating as well, right? So you can see the crossover here. It's like, all right, well, that could also be in the realm of an eating disorder. But it's, if you have an eating disorder and other disorders, then technically you're more likely as an adult to have ADHD. So that's your impulsivity component. Now let's talk a little bit about this emotional dysregulation that's talked about in the adult population, more specifically. Mood lability, right? So that's fluctuation in mood, high highs, low lows, but you also see that in bipolar disorder. So people with bipolar disorder could also have ADHD, but bipolar could look like ADHD. So you can see where this can get confusing. Low frustration tolerance, emotional impulsivity, right? And that can go with a labile mood. Irritability, anger, outbursts, premenstrual increase of symptoms like your hormonal cycle can certainly affect this emotional dysregulation and ultimately your attention as well. So once again, having 3 or more disorders was associated with a 10-fold increase of having ADHD in a population study of 20 countries. That's that whole thing that I talked about. Adults with ADHD often have other psychological diagnoses, right? And this crossover can make things confusing. So that's your emotional dysregulation component. ADHD types. All right. So you could have predominantly inattentive presentation where it's an attention issue, right? They might not have that hyperactivity component where they're having trouble sitting still. All right. You could also have predominantly hyperactive impulsive presentation where it's more impulsive, it's more hyperactive. This person fidgets and talks a lot. It's hard to sit still for a long. Smaller children may run, jump, or climb constantly, right? An adult in that realm, they may just really have trouble sitting at a desk. Those might be those people that are impulsive to quit the job, right? Or to quit the activity or to quit, the project at work and not just not be able to sit still at the desk. but there's also the combined presentation as well, where you have both, right? And then this is where we get into the realm of ADD versus ADHD, attention deficit disorder versus attention deficit hyperactivity disorder. So you don't necessarily have to have hyperactivity. You could have more in the attention side of things, or it could be combined. So a little bit deeper into the ADHD diagnosis. So what does it technically take to get diagnosed with ADHD according to the DSM-5, right? The book that has the diagnosis for ADHD. Several inattentive or hyperactive impulsive symptoms must have been present prior to the age of 12 years old. I think it's coming into vogue now more that an adult could be diagnosed with ADHD and not necessarily have had that diagnosis prior to 12 years of age, like this suggests is needed. So I wouldn't be surprised if over time, like, this number changes, or we're just not looking at it this way as far as when we're talking about diagnosing adult populations. But it is pretty likely that if you have this issue as an adult, you had it as a child. Although we see some people that were diagnosed with ADHD, say, after they've had a concussion. But with a concussion, you can have impulsivity issues, you can have hyperactivity. And technically, you're exhibiting things that look like ADHD. You're having attention issues, you're having impulsivity issues, you may be exhibiting some of these hyperactive activity type states, but it's more directly related to this concussion. Hey, I didn't have this before I had the concussion, but some of these people still carry an ADHD diagnosis, right? And that's where some of the confusion can get in. Fortunately, the way we're looking at it at the clinic, and we'll get into that in a little bit, the bottom line is that we're going to treat what is in front of us, right? We're going to treat that individual, and we're going to work on the areas of the brain that could have been affected by a concussion or a longer standing ADHD diagnosis that may have genetic and environmental components that, go back to birth or slightly thereafter. Several inattentive or hyperactive impulsive symptoms are present in 2 or more settings, meaning that this can't just happen at home, at school, or at work, right? Just around certain people. Usually if we're looking at that, it's more just behavioral challenges and like a one-on-one relationship challenge, maybe with family members that are at home, or the group family member dynamic at home. If you're truly dealing with ADHD, you have pretty similar symptoms at home, at work, right, in different environments. If it's just in one environment, it may be some kind of dynamic with the other people that you're with in that other environment, or the environment itself. There is a clear evidence that symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So that, there needs to be a certain level of significance with those symptoms. ADHD diagnosis continued. The symptoms does not occur exclusively during the course of schizophrenia or another psychotic disorder, and are not better explained by another mental disorder, right? But I talked about how, in particular, when we're talking about adults, like it's more likely that you have ADHD if you have other diagnoses, but we don't want to confuse it with the other diagnoses, and this is where it can get confusing. The symptoms are not solely a manifestation of oppositional behavior, defiance, hostility, or a failure to understand tasks or instructions. And then for older adolescents and adults age 17 and older, at least 5 symptoms are required. With children, it's 6. With adults, it's 5. And then I'm going to go through the symptoms with you quick. Inattention diagnostic criteria, once again, you need 5 of these 6, right? To a degree that is inconsistent with the developmental level and that negatively impact directly on social you got to have significant symptoms, okay? Negative impact on social and academic/occupational activities. So the inattention diagnostic criteria often fails to give close attention or to details, or makes careless mistakes in schoolwork or work, or during other activities, often has difficulty sustaining attention in tasks or play activities, often does not seem to listen when spoken to directly, often does not follow through on instructions, and fails to finish schoolwork, chores, or duties of the workplace, often has difficulty organizing tasks and activities, often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, often loses things necessary for tasks or activities. Okay, so you have to have these 5 of these different issues technically to qualify for an ADHD diagnosis. So you can see it's all about behavior, right? And how this is manifesting for you. And I don't mean it from, the context of like, oh, this is just your behavioral issues, so just stop doing that behavior. No, it's just it's how these neurological challenges that you're having manifest, and then it affects your ability to attend to things, to maintain that focus. Okay, but we're diagnosing here purely on behavioral output, not necessarily what's going on with the brain. Okay, and that's what makes us different here at GCNC, and that's what we're going to get to in a little bit. But the hyperactivity, impulsivity, and impulsivity diagnostic criteria, it's the same thing. You need at least 5 of these things. You need to be dealing with it for at least 6 months, right? Often fidgets with or taps hands or feet, or squirms in seat. Often leaves seat in situation run or remain seated as expected. Runs about or climbs in situations where it's inappropriate. It's probably a little bit more on the childhood side of things, but often unable to play or engage in leisure activities quietly. Is often on the go, acting as if driven by a motor. Often talks excessively, often blurts out an answer before a question has been completed, often has difficulty waiting his or her turn, and often interrupts or intrudes on others. So you need 5 of those 6 things. Then we can say that you have the hyperactivity component, right? So let's say you have 5 in the attention component and then like 3 in the hyperactivity. I guess then technically you don't get the hyperactivity component in your diagnosis. But at the end of the day, people could still be having issues with certain types of hyperactivity behaviors or certain types of attention behaviors, right? We see a lot of people that technically wouldn't qualify for the ADHD diagnosis, but they're still struggling in their life. They still need help, and we can help those individuals. So typical ADHD treatments, we're looking at cognitive behavioral therapy and medications primarily. Those are the typical treatment methodologies. But that's a little bit about cognitive behavioral therapy in a nutshell. So it's teaching you strategies to influence your behavior, influence your feelings about certain situations and feelings in general, and influence the way you can work through your thoughts. Okay, and how these things interact with each other. I'm not an expert in this area, but this is, one of the stereotypical things that can help with ADHD, and it's a powerful tool. On the medication side of things, oftentimes we're thinking Ritalin, right? We're thinking stimulants, and stimulants are definitely one of the medications that are used. The long-term effects of ADHD medications on young children it's not been well studied. That's coming from the CDC. Okay, it hasn't been well studied. So arguably not really with adults either. Adults with ADHD often have other medications for psychological diagnoses that may negatively interact with ADHD meds. I've kind of repeated it a few times, right? It gets a little messy. Is it my ADHD? Is it my depression? Right? Which one is it? Is it my bipolar disorder or my ADHD? I've got an eating disorder and I've got ADHD. And there can be medications that are prescribed for these other psychological challenges that people are having. But then those medications may not jive with what's typically prescribed for ADHD, and that can lead to complications. Hopefully, people are not prescribed inappropriate medications for ADHD that could interact with what they're already taking. Not to say that ADHD drugs are inherently inappropriate, but it's inappropriate to prescribe this drug and this drug because they may interact together. So you need to make sure that the right drug is prescribed that won't interact with something else. And you can see where this gets very complicated. And then, naturally with all medications, there's side effects. But anyway, 2 classifications of ADHD medication. We're looking at stimulants, which often it contains forms of methylphenidate or amphetamines. And, we're looking at those to increase brain levels of dopamine. Non-stimulants, there's different categories with that. Oftentimes, it's meant to affect your adrenaline system. So those are your medication options. Not all of them, but those are some of the common ones. So what else is there for ADHD? I'm going to talk about a couple things. I talked about this in my childhood ADHD talk, Saffron, and naturally I talked about chiropractic neurology as well, which is what we do here at GCNC. So Saffron and ADHD, it's the most common prescribed drug for treatment of ADHD is methylphenidate. And it's believed that it can improve cognitive function through a dopaminergic effect. So we're looking at affecting dopamine, as I said. 30% of children with ADHD, however, do not respond to methylphenidate, and saffron has several psychoactive properties and acts as an NMDA and GABA receptors, facilitating dopamine, serotonin, and noradrenaline secretion, right? And I talked about how those non-stimulant drugs that are involved with ADHD affect the adrenal system. So it's, some of the preliminary research with saffron shows that it can affect both dopamine, which is hopefully what we're getting from our medication, right? But it could also affect the noradrenaline or adrenaline system. So kind of a 1-2 punch with saffron. Granted, there's not as much research with saffron as compared to the medications, but both the dopamine and noradrenaline are core neurotransmitters associated with ADHD, like I just talked about. So there was a pilot study that compared the efficacy of 30 milligrams of saffron and ADHD medication, right? And the most relevant finding is that both treatments showed statistically significant improvements in both core ADHD symptoms and executive function. But a pronounced difference was found in the saffron arm, in the sense that parents with the children treated with saffron reported a pronounced improvement in the time to fall asleep. Right? We talked about how sleep and ADHD, they're usually a little bit at odds, right? Especially when some of these stimulants get involved. Granted, this research was with children, but it can translate to adults as well. That saffron can have a positive effect. But saffron is something that's worth looking into if you have ADHD symptoms or ADHD itself. Certainly if you have ADHD itself, that's what these studies were involved with. Let's talk a little bit about areas of the brain associated with ADHD. So some of the things we see with the brain in ADHD is a reduced total volume and volume of some brain structures. So smaller volume of some brain structures. There's delayed cortical maturation in children and adolescents, and reduced cortical thickness in adults, right? The actual thickness of the cortex may be reduced with people with ADHD. So a little bit less brain mass we're talking about. Regions of the brain that have been implicated in ADHD correspond to brain networks or groups of areas of the brain working together. That's more how the brain works. It's not areas in isolation. It's these groups of areas that work together. We're going to talk about 3 of those areas of the brain that work together in groups today, involving frontal regions or supporting executive function and attention, right? That's an example of some of those brain networks. As in child ADHD, abnormalities in adults appear to encompass prefrontal cortex and its connections to the striatum, and with additional networks involving the cerebellum and parietal cortex. So today we're going to talk about the parietal cortex or the parietal lobe, the cerebellum, and the frontal lobe as well. Because those are some of the areas implicated. There's also other areas like the basal ganglia that can be involved with ADHD, but we're just going to focus on a few today. So assessing brain function, right? We want to look at how these different networks fire, right? Are they doing the jobs that they are supposed to do? These different areas of the brain, the cerebellum, the occipital lobe, the temporal lobe, the frontal lobe, the parietal lobe, right? And how they communicate together, these networks or these pathways that fire, where there's these groups of the brain that fire together to to execute different tasks. Can that task be executed appropriately? Or is there some challenges with it? And different networks have different jobs to do. And they can have multiple jobs to do. Or different areas of the brain can have multiple jobs to do. The frontal lobe is involved with executive function, but it's also involved with motor control. So let's talk about those frontal lobes. So the frontal lobe, the boss. Some people look at it as the boss in the brain. It's involved with planning and goal setting. The boss in the sense that it's involved with executive function, right? It's calling the shots for certain things, although, there is no boss of the brain. It's an integrated network with multiple areas working together. But it's also involved with motivation, attention, okay? And then there's this area in the frontal lobe called the motor cortex. And body parts that make up the finest movements take up the most space, right? So you can see there on that picture of the motor strip that the hand is represented very large, as is the face, right? And as is the tongue, compared to, say, the feet, and the toes are much smaller. So the larger they are on there, the bigger the representation they have in the brain, and arguably the more fine movement, right? The little movements that are involved, right? So we have to have high precision control. So the right frontal lobe has a map of the left side of the body, and the left has a map of the right side of the body. So how do we assess frontal lobe function? Many different ways, but here's a couple. Finger tap, looking at that fine motor movement that I talked about. How does one side compare to the other? Is one side slower with like lower amplitude compared to the other? Right, so we can start to differentiate between networks that involve, one side frontal lobe versus the other. We're also going to look at gait with and without dual task. A dual task would be like walk and count back from 100 by sevens, right? When we start to do these cognitive activities, do we see decreases in arm swing, right? Or do we see freezes and hesitations compared to how people walk when they aren't using that executive function that involves that frontal lobe? So if we see that you're stumbling when you're having to multitask while you're walking, and your finger tap is like low amplitude and kind of small, it's like, all right, that frontal lobe and some of the areas of the brain that work in an integrated fashion with it may not be firing too well. So we'd want to do sensory and movement-based exercises to get those areas of the brain working better. And you know what else the frontal lobe's involved with? Focus and attention, and the ability to act without hyperactivity. Also, saccadic eye movements. Saccades are fast eye movements, right? So I'm trying to get this in view on the camera, but there we go. Okay. We'll wiggle one thumb versus the other and have people jump their eyes in one direction or the other, okay? And eyes moving rightward is predominantly coming from the left frontal lobe, okay? And vice versa. So if we see that there's decreased speed with both in how it travels and an increased latency, or what is the delay from when the target moves to when the eyes move, if we see low velocity and what's called a decreased latency, then we're typically thinking there's some frontal lobe involvement with that potentially, and it's the side opposite the eye movement. I think I have that written down inappropriately, and I apologize for that. So yeah, it should be opposite the eye movement. That's the side of the brain that's involved. So sorry, that was a typo. Parietal lobe creates and contains the somatosensory map, okay? So there's a motor map in the frontal lobe, and the parietal lobe has a somatosensory map, okay? So the somatosensory map perceives touch, nociception, which some people associate with pain, pressure, temperature, different types of sensations, okay? It's processed by the parietal lobe, and that gives us a excuse me, a sensory map of our body. And you see it kind of looks like the motor map. Body parts with the most sensory receptors take up the most space, like body parts with the finest amount of motion take up the most space in the motor cortex. And the right parietal lobe has a map of the left side of the body, and the left parietal lobe has a map of the right side of the body. So how do we assess the parietal lobe? Graphesthesia, if we want to assess the left parietal lobe, we're going to draw maybe on somebody's hand like the letter A or B or C, whatever letter. Then say, hey, I'm going to draw a letter on your hand. Tell me what letter it is, and we'll do it with your eyes closed. And people should be able to tell you what letter it is. And it's surprising sometimes with patients, they have no clue. I'm drawing a letter A. Fairly straightforward. No idea what I'm drawing. No idea what I'm drawing. So they don't have a good sensory awareness of that limb, okay? And it can be related to their parietal lobe. Toe localization, also like grabbing toes, and it's like, okay, touching toes rather. Tell me which toe I'm touching, right? And let's pretend this is somebody's foot. So like I might put it on toe number 1, the big toe, 2, 3, 4, 5. So I'd be like, all right, what toe am I? Oh, you're on 1 on the left. And it's like, no, that was 4. Okay, sometimes they have no clue that which toe you're on. So they don't have a good sensory map of that toe. So then we know that their parietal lobe isn't functioning as well as it could be. So then let's talk about the cerebellum. It's involved with coordination of movement and thoughts, helps create postural tone, has its own map of our body, right? Just like there's maps with the parietal lobe, there's maps with the frontal lobe. There's other maps in the cerebellum as well. But it's involved with coordinating movement and coordinating thought. And you can see where the frontal lobe is involved with initiating movement, right? And the cerebellum and the frontal lobe work hand in hand. They don't work independently. It's not like the frontal lobe's like, all right, we just initiated the movement and I'm completely out of the mix. There's a lot of communication back and forth between the frontal lobe and the parietal lobe to make movement happening and keep it fluid. So the right cerebellum, we typically think of it as working with the right side of the body for volitional movements, movements that we can control. And the left cerebellum, we think of it as working with the left side of the body for volitional movements. So how do we assess it? Rapid alternating movements where we flip-flop hands back and forth. People, sometimes it's very slow, or it's just real small amplitude, or it's just erratic, right? Dysdiadochokinesia is if it's just kind of all over the place. Finger, nose, finger, right? So there's my finger here. I'm the doctor, right? And then the patient's going to touch their nose, touch the doctor's finger, touch their nose, touch the doctor's finger. But they're going to have to reach out pretty dang far, okay? Because we want them to really have to extend out. So they may have some issues with that. And also what's known as a heel to shin test, where how fluidly can they slide their heel down their shin. And you can see a picture of that. So if we see a bunch of these things and it's like, hey, like you don't really have fluid movements, you have poor sensation in your hand, like you can't tell what letter I'm drawing, and and your finger taps real slow, and you freeze when you walk, like you're having issues with all those areas, right? And then you've got an ADHD diagnosis on top of that. So the idea is that we then challenge those areas of the brain, those networks that work together that are involved with ADHD, right? Focus, attention, and hyperactivity. And then we do exercises to strengthen the communication in those networks. And then, lo and behold, people can focus, attend to things better. They can sit more still, right? Things can get better. So what can we do? We talked about fast eye movements, right, with the frontal lobes to diagnose, issues with that area of the brain and those networks that generate saccades. But you can also do saccades as a therapy. So you might start with doing saccades at slower intervals or faster intervals, depending upon how you want to affect those saccades, if you want to increase or decrease latencies, right? Or you just want, sometimes people just can't get their eyes over there to the target. They're just all over the place. I've seen it especially with a lot of kids. With children that I've worked with, some of them just can't keep their eyes on a still target. And we got to start with that before I can get it to where it's like, okay, look at the thumb that wiggles. They can't just look at a stationary target. I see that to that level. I see it less with adults, but there's still adults where like they really have trouble like just keeping their eyes still on a still target. So that's something we have to start with. But with the parietal lobe, we could do different sensory exercises because it processes sensation. So what's called point localization. That's where I touch a spot and then the person has to touch the same spot. I may have them do it eyes open. Okay. So they can help use their vision to get more accurate, and then they close their eyes and it's like, oh, I've paired where I can see the location with where I can feel the location, and now I can better feel the location because I was able to see where it was at. Also, we might do some vibration therapy on different parts of the body or the body as a whole to send a barrage of input up to the areas of the brain in the parietal lobe that process sensations. The cerebellum, we might do what are called complex movements. We might do like figure 8 movements with an arm and a leg in opposite directions because the cerebellum is involved with coordination of movements, and that's a pretty coordinated task. And we might do it on the right side of the body to affect more the right cerebellum and those areas of the brain that work with the right cerebellum to help coordinate movements. And then with time and repetition, these things can stick. And then just existing in a rich environment, both mentally, emotionally, socially, right, can help your brain thrive once we've kind of jump-started the system. And then focus, attention, a calmer sense of being, right, less hyperactivity can come a little bit further down the road. So before we get to thank yous, I do want to talk about some people that we've worked with. And I don't want to name names specifically, but I remember there was one individual that I saw that had these focus and attention issues. Oftentimes had trouble sitting still. This individual was, I'm not going to use names, but we'll use a fake name and we'll call him Jake. So Jake was super intelligent, but he struggled with confidence a little bit because he struggled in school, and he had to sit for a very big class and examination in his field to get. It was kind of the highest level in his field. He was working with heavy equipment, and he wanted to graduate to the highest level of heavy equipment, the biggest machines that he could possibly work on. And this is a big test. And, he had some test anxiety about it, and his ability to be able to attend to, like focus, absorb the information, right? So we did a series of exercises with him to help his cerebellum, right? We did cognitive exercises with him to help his frontal lobes work better, to help his focus and attention, right? And that cerebellum and that frontal lobe work together in tandem. And they can, if we get the cerebellum and the frontal lobe working better, then those are areas that are often seen with having problems when you have ADHD. So if those areas and networks are doing better and the fluidity of movements, the speed of saccades, it's probably also going to do the job better as well of helping you focus and attend to things. And that's what happened for him. He was able to complete that test and now works at the highest level of his industry with the largest pieces of equipment in his industry, because he was able to focus and attend to things, right, and inhibit impulsiveness and hyperactivity to be able to take that test and pass at the highest level. So that was definitely a rewarding experience working with him doing these exercises. So if you're one of these people and you went through this talk today, you probably already had a pretty good idea of like, I think I might have ADHD and I'm an adult and like work is affected and my relationships are affected and I feel scattered. But if you're one of those people, we'd certainly be happy to talk to you. We always do a complimentary consultation to learn more about you, to make sure that we're a good fit for helping you overcome these challenges. So while medication can be certainly a valuable thing, as can cognitive behavioral therapy, to learn to cope with these things and to get through things, if you're still dealing with these issues that we see with ADHD, then you definitely deserve a closer look. We need to look at your brain. We need to go beyond the behaviors, right, that are exhibited with ADHD. And we need to go to the brain that helps generate these behaviors, whether they're positive or negative, and switch things over from the behaviors that you don't want to have to the behaviors that you do want to have. And it's not because you just said, I'm not going to do this anymore. It's because your brain is just inherently working better, and you can focus and you can attend to things and you can sit there and absorb what you want to absorb and be with the people you want to be with and not feel like you're constantly on the move and you just can't absorb the information. You can't pay attention to that person sitting next to you, right? We want to bring presence into your life, and you can do that by changing how your brain functions. And anyone at any age, child, adult, senior, can do these things. So we'd be honored if we can be a part of that journey with you. So complimentary consultations, we'd be happy to talk to you with you for about 30 minutes or so, but just reach out and we're happy to answer some more questions and dive in. And if you have any questions about this presentation, we're happy to talk about those too. Thank you for your time, and I hope you have a wonderful day.